Hi, it's noon. This is Carmen Cawthon. Happy to be with you today. It's kind of excited. We've been talking a little bit about the health disparities in America between African Americans and whites, and how this is really showing up as a result now of the coronavirus. And so we've been talking a little bit about some statements that Dr. Fauci made and where that's going. A lot of states are now, including North Carolina, reporting their COVID deaths by zip code. And in a lot of the zip codes where the largest number of deaths are, you see that those are zip codes that are people of color, African Americans. And in the process of the research that I had been doing about health disparities, and we've been talking about the number of African American medical schools that had been available and had shut down based on the Flexner report back in 1910. But that can't be all of it. So I remembered yesterday that I had a book that I had not written. And for those of you who know me, you know I like to read. For those of you who don't know me, I am a readaholic. I usually have anywhere from 2 to 4 books going at the same time, at least one fiction, because sometimes I just don't want to think, and so I just need to read something silly. But at least I think I have right now 3 nonfiction books going. And so this is the book that I'm going to read some from this today. It is, let me see if I can get this in here right. Black Man in a White Coat. It was written in 2016, I believe, by Damon Tweedy, who is a doctor in the Triangle area. So let me see exactly when this was written. It was copyrighted in 2015, and it's broken into 3 parts: disparities, barriers, and perseverance. And I'm going to read some portions out of this today and then just talk about those portions, because they're really interesting concepts. And if you're African American, you've probably felt some of this. If you haven't, you have been in a new and different place. So in the disparities section, one of the first things, this is on page 12, one of the first things that happened to Dr. Tweedy, and he was a student in a Duke medical student. This is what he says. He had stepped out during a break and came back into the lecture hall. And he says, when I re-entered the lecture hall a few minutes later, Dr. Gale, our professor, headed in my direction. Ordinarily, he didn't socialize with students, so I expected him to walk past without acknowledging me. Instead, he stopped directly in front of me. Are you here to fix the lights? He asked. The sounds of the classroom seemed to vanish. So did my peripheral vision. Calm down, I told myself. Maybe he was talking to someone else and only seemed to be looking at me. I glanced behind me. Nobody there. A few classmates were within hearing distance, but they seemed too engaged in conversation to notice us. Maybe with all the background noise, I had misheard him. Did you ask me about fixing the lights? I said. Yes, he replied, irritation creeping into his voice. You can see how dim it is over on that side of the room, he said, gesturing with his index finger. I called about this last week. Reflexively, I stroked my chin and looked down at my clothing to see if I seemed out of place. Clean shaven and dressed in a polo shirt and khaki slacks, I thought I'd done a decent job of looking the part of a preppy first-year medical student. Obviously, I had failed. No, I said, stumbling to come up with a reply. I don't have anything to do with that. He frowned. Then what are you doing here in my class? My mouth went dry. Why had he intentionally me out in this way. Race was the first thought that entered my mind. I tried to summon an attitude of 1960s era Black Power defiance, but what came out sounded like 1990s diffidence. I'm a student in your class. Oh, he said. Dr. Gale looked away, then walked off without another word. I staggered to my seat, sitting through the second part of his lecture like a robot, tuning out his voice. What had started as a promising day was spoiled. So my comments on that are, that's part of my everyday life. Not as much as it has been in the past. But too often, African Americans aren't seen as people who are professionals, are where they're supposed to be. You know, it's like you're not in the right place. And that's been part of my life, all of my life, because because my parents were active in the community and trying to make a difference. A lot of our roles, we ended up being in places where we were the only African American in our classroom, in our school. You know, when I first started elementary school at Francis Lacey here in Raleigh, it was 3 weeks after Martin Luther King was assassinated. We moved into a predominantly, I was going to say predominantly, but it was the only other one Black family in our neighborhood, and they were an older couple, and both of them were very light skinned. So unless you knew they were African American, you just assumed they were white. And they didn't have any kids in town. They were retirement age, and so when we moved in, there was only our Black family. And when we went to Francis Lacey, there were 4 Black kids at the school, and I was one of those. And I was the only one who walked to school every day. So from that point, for most of the rest of my life, it has been, do I fit in here? Do I not fit in here? It's not that I haven't made friends and people haven't reached out to me, but those feelings come up and those kinds of actions occur all the time. And so you do look, you like he said, he looked to see if the professor was talking to somebody else, because certainly he wasn't talking to him, but he was. Okay, jumping on. This is another section that he talks about. There is a perception of us as the best Black, which is a term coined by Yale law professor and novelist Stephen Carter. In the post-civil rights era, college and professional students still sought to enroll the best white students, as they always had, but they also began a new urgent mission to bring the top Black students into their halls. Jumping through a couple other sentences. There are Black folks out there. Go and find the best of them, Carter wrote, describing the mentality that he saw as pervasive across several areas of society. Now, mind you, he's talking about stuff in the mid-90s, 1990s, not 1890s, 1990s, removed from us. And I don't know that that's gone yet. I still think that look for the best Blacks is still very pervasive. It's frustrating for me to teach my children to not have to worry about race, because they do. I mean, that's just the fact of the matter. So moving on to the next section, and I'm only about halfway through the book. Because of the action or the way this Dr. Gale, the professor, had treated Dr. Tweedy as a first-year medical student in a first semester class, he determined that he was going to work his tail off and do the best he could and show that he was supposed to be there, because he was already worried about, he was one of maybe 14 students in the whole first year medical class. And he wasn't sure, because he didn't come out of a prestigious college, that he would fit in. So he busted his tail anyway to get in and to do things the way he was supposed to do them, or the way he thought he was supposed to do them, to make sure that his that he was going to make it through. So when it came time for finals, he did his final exam. He had not done terribly well on his midterm. Evidently, what does it say here? The final counted twice as much as the midterm, and he hoped that he had earned honors, the grade reserved for the top 10 or so students. And he carried his exam to Dr. Gale, the professor, during his student hours to see if he did, in fact, qualify. And he said when he walked in that obviously Dr. Gale asked him. He doesn't talk about whether or not they've had any other interaction during the rest of the semester, but I'm sure class participation was part of the grade. So he says that the professor asked how he could help him, and he gave him his midterm and final exam, asked if he had met the cutoff for honors. And he said that the professor his eyes widened as he looked at the final exam score. And he removed his glasses and squinted before putting them back on to make sure his vision was not failing. He then stared at my ID card to see if the name on the exam matched my Duke badge. "Wow," he said, unable to conceal his astonishment. "I am very impressed that you scored this high. You definitely earned honors. You have absolutely nothing to worry about." Now, just for me, I always had something to worry about. It didn't matter that I made the highest grade in the class. It didn't matter that I was the smartest person in the room at the time. I always had to worry about that. It was part of why my mama said, you always have to do double or better than everybody else in order to be considered smart. And I hated that, but I knew that was what I had to do. I knew that. So the professor went from asking him at the beginning of the semester if he was in the room to change the light bulbs to, "Congratulations, this is really incredible. Would you be interested in doing research in my lab?" And see, you would just want to smack him. So that's what he says. In just a few weeks, I had gone from pariah to prize pupil. This unmitigated praise felt like another aspect of Stephen Carter's best Black syndrome. The stereotype of Black intellectual inferiority was so ingrained that for a person to do as well or better than whites or Asians, they had to be exceptionally bright, earnest admiration and condescension wrapped in the same package. I wanted nothing to do with a professor who could be so dismissive of me one moment, only to change his mind without apology, as if his earlier comments could be erased like chalk on a blackboard. Do you get that? So people treat you poorly, and they don't even know they treated you poorly. Or if they do, they don't acknowledge it, and they don't apologize for it. And then when you do something they didn't expect you to do, then they're just full of admiration and praise. Yes, that's the life we live. It's frustrating. Okay, going on. So talking about health disparities, this young African-American doctor had family members who had hypertension, which is high blood pressure. And he knew his grandmother had a stroke. He had an uncle to die at an early age because of high blood pressure. But he assumed because he was young and tall and very healthy that he was fine until during the first year or some of the first courses when the medical students were practicing on one another, his blood pressure was extremely high when they took it. And so he was sent to the doctor, and they talked about it, and he made the decision not to go on medication, but to use diet and exercise to bring his blood pressure down. But this is some other information that he shares. Hypertension is a typical disease when it comes to Black health disparities. It's about 50% more common in Black people than in whites, afflicting nearly 2 out of every 5 adults. It also strikes Black people at a younger age, and Blacks are less likely to have their blood pressure adequately controlled. Consequently, hypertension tends to run a more aggressive course in Black people, increasing the risk of several other diseases that are also more common in Blacks. examples are stroke and kidney failure. The reasons offered as to why Black Americans suffer so severely from hypertension are as diverse as the fields represented. The psychologically oriented journals cite the stress of American racism. Evolutionary scientists theorize that among African slaves, those best able to retain water survived the harsh Atlantic journey, passing on their genes, which later proved problematic in the modern world. Public health writers comment on the various inequities in our healthcare system and cultural differences in dietary and physical activity patterns. Okay, so that's just a little bit of information about hypertension and some thoughts that are out there about what could have caused it to be so much more prevalent in the African American community. I was diagnosed with high blood pressure when I was in my 20s. And it's fairly well controlled, but I could do better. And a lot of us can do better. A lot of people don't have access to health care. They don't have access to insurance. And if they're in rural or if they're not in a well-populated city, they don't have access to doctors, regular, what we consider, or what I consider regular primary care physician status. So they may only see a doctor if a clinic comes. Okay, so let me read a little bit more here. A 2005 New York Times article vividly illustrates this dramatic influence of social class as it follows the journey of three New Yorkers, one rich, one middle class, and one working class, who each suffer heart attacks around the same time. And remember, I said heart disease, stroke, kidney failure, all of that is mixed in with hypertension for a lot of people. In describing their uneven recoveries in which the wealthy person is left better off, the middle class man fighting through a setback, and the working class woman struggling with increasingly complex medical and social problems, the author observed class informs everything, from the emergency care each received, the households they return to, and the jobs they hope to resume. It shaped their understanding of their illness, the support they got from their families, their relationships with their doctors. It helped define their ability to change their lives and shaped their odds of getting better. I saw a similar contrast between me and the women at the rural clinic. As a Duke student, I had health insurance. I didn't have to think about seeing a doctor or filling a prescription. Everything was covered. For each clinic visit, I see Dr. Katz and enjoy benefits doctor-patient relationship. Tina and Pearl, who are two women that he had seen at a rural clinic, had to go to a monthly free clinic where doctors rotated each month. This meant they had to start over with the hopes that the next doctor would be as caring and competent as the previous one. While Tina's initial was cheap, Dr. Watson worried that her blood pressure was so high that she would likely need a second or even a third medicine that could each cost in excess of $50 or more a month. So while Tina, Pearl, and I were all Black and hypertensive, similarities ended there. Glaring differences. It should come as no surprise that the insured as a group have worse health outcomes and higher death rates than people with health insurance. A 2002 Institute of Medicine report noted that in one study over a 17-year period, adults who lacked health insurance at the outset of the study had a 25% greater chance of those that had private health insurance. A major 2001 study found that a lack of health insurance is associated with an increased risk of decline in health for adults over age 50. Delayed and chronic conditions are poorly managed. Both factors result in a dizzying array of medical complications on the way toward a premature death. As with so many societal problems, Blacks suffer to the largest extent, being nearly twice as likely as white Americans to live without health insurance. And while obtaining health insurance alone does not fix the health problems of the poor, it makes a real difference. A 2007 study found that previously uninsured adults, this is amazing. This is an amazing. A 2007 study found that previously uninsured adults, in particular vascular disease or diabetes, reported improved health over a 7-year follow-up period after obtaining Medicare coverage. 65. Okay, and I'm going to stop here because Medicare coverage comes Social Security. When Social Security Administration was originally started and the law was originally written during the Depression age, farmers and household workers were not allowed to collect or to Social Security. So I do not remember when that changed, but consider now, white people or people who had professional positions were able to collect and put into the Social Security system for 20 or 30 years when people who were household workers were not. So that also gives you a like 20 to 30 year jump on which people were able to take advantage of Medicare. Some of these are things that, nobody tells you this in your history class or your social studies class when you're in school. But the law was deliberately written that way. Now you consider how many African Americans, people of color, poor people, were farmers and household workers. That's a huge part of the African American population. So therefore, that was other them. So for you have to reach 65, and then the next 7 years, your health will get better because you get kind of health insurance. That's sad. That's frustrating, and it kind of pisses me off in case you couldn't tell. Okay, next place I'm going to. So he talks about doing some rounds in medical, or when he was in his residency. And so when you're doing rounds, and okay, let me just read this. So this is how the medical students talk when they're doing rounds with their teachers, professors. So you're beginning of a patient's case. So he says, Mr. Gary Warren is a 55-year-old African-American male. This three-pronged age, race, gender description was the traditional way. Once again, the only Black person in the room, I wondered if anyone else there had added this method and shared any of my concerns. Age was obviously important to know. The cause and severity of chest pain in someone 65 years old had different implications than it did when presenting in a 20-year-old. Gender, too, importance. Lower abdominal pain in a woman meant considering the pathology of completely different internal organs than did in a man. But why did it matter so much whether the was Black or something else? Did this way of presenting cases assume that race should automatically color the way a doctor approached a patient's chest pain or achy stomach? Okay. As you know, it's still done today. If you, I know if I go into somebody that I'm taking care of, include their patient records, so you get, like when you finish with your doctor's appointment, you get a summary of your visit. But some doctors and hospitals have, they have like UNC Rex and WakeMed. They have a portal for you to go into, and you can look at not just the summary of your discharge summary, but you can also look at the doctor's notes. And this is how most of the time the doctor's notes, the case is presented in the doctor's notes. It's the age, the gender, and race. And I wondered when I first saw that, and I thought about it in terms of health disparities. how does that mean that you're looking at me? Are you looking at me as, and I've always known as a female, I don't necessarily get looked at as well as a male, but I never thought about until I really read this. Am I really being as a Black woman? Okay. All right. So the next thing he talks about, or another thing he talks about, is how he was treated as a patient himself. I couldn't get out of my mind how I'd been treated as two entirely different patients. This is after he's been playing basketball and is having some problems with his knee. He finally decides to go into urgent care. Damon Tweed, the unknown Black man dressed like he was about to mow the lawn, couldn't get the doctor to look him in the eye. Or Damon Tweedy, MD, was worthy of personal first-class service. While widely known that doctors get special treatment from their colleagues, this was far beyond the usual professional courtesy of an convenient appointment. Receiving a physical exam and medication and a brace when you otherwise would not wasn't just better service, it was different medical care altogether. Doctor, aware that his initial lack of attention had been unfair and insulting, leading to overcome his subsequent actions. Perhaps, but I was more interested in the reasons for his initial approach to me. He evidently saw me through a mental filter, and his assumptions were not positive. Several authors have written about the negative stereotype many doctors associate with Black patients: poorly educated, drug abusing, not likely to comply with treatments. In short, the kind most doctors don't want to treat. And then he says, appearance and dress matter for everyone and how they're perceived. But the prevailing wisdom among Black people is that it's much more important for us than it is for others. Even if the impact can't be studied or measured, many Black people will tell you that they have to dress better than a non-Black person to be seriously. I certainly learned my lesson. Since that day, when I tag along with a family member who already know me, I put on a sport coat. Sometimes I wear a tie too. At the very least, I'm certain to wear a collared shirt and slacks and a pair of nice matching socks. So, first thing is when he went into the urgent care, the doctor didn't give him any eye contact, didn't touch his knee, which was what he was complaining of pain. Didn't try to see how swollen it was, went directly to the computer and talked to him while he was looking at the computer and told him to just go home and take it easy a little bit and take some Tylenol or some ibuprofen. She started to ask questions that showed he medical knowledge. The gentleman looked at him and said, do you work in a medical field? And he said, yes. And so he said, are you a radiologist? And he said, no. And suddenly the doctor changed everything that he did. I have run into these kinds of situations. When my mother was diagnosed, she knew she had diabetes. Her blood sugars were going up, and she wasn't feeling well because she let me go to the doctor with her. And so she was sitting in there with the doctor, and he told her that her fasting blood sugar was whatever. And he said, why don't you try some diet and exercise? Now, first of all, he did not know Mom. He did not know that she was 80. She was 75 or 80. She was somewhere in that range. She still went daily. She walked. She did exercises. She worked. So she'd already been doing exercise. She already did dieting. She watched everything that she ate. She made sure that she was within range of what she was supposed to do. But her blood sugar was still climbing. So she looked at him and she didn't say anything else because she wasn't feeling very well. And that's where he stopped. And I said to him, my sugar is higher than hers, and I'm on medication. She's been doing diet and exercise for a while. You don't think she needs medication? And he looked at me and then he said, well, we could start this, that, and the other. But it wasn't until I said something, and I've been in other situations where I'm helping take care of a family member, and doctors don't necessarily offer things to them. And so I say, okay, in my research, this is what I have seen or looked at that's been helpful. Is that something that you think will work? And they will look at me and they'll say, oh, work medicine? No, I don't have to work in medicine to have some knowledge. And if that's something that you can offer to a patient, whether it's medication, whether it is some other type of treatment, why do you only offer it to some people, offer it to others? So I think that's where some of our health disparities as well come in, because we aren't necessarily always offered the same things that white people are offered. And that is what it is. That's as far as I'm going today with this. I'll go back to some more research next week. Again, the name of the book is, let me see if I can get it here, Black Man in a White Coat by Dr. Damon Tweedy. And it's an excellent read. It's a really quick, like I said, I started this last night, and it's, unless, of course, you hate to read, then that could be problematic. The book itself is about 250 pages, and probably another 30 pages of notes and bibliography. But like I said, it's an easy read because it feels a little autobiographical. So if you like autobiographies, you'll enjoy getting through it. I hope you will like and share this. And as I find, because I have a wealth of books in my house, as I find some other things and some other information, I will share those. If you are interested, please reach out to me. You can reach out to me on Facebook, and I'll be happy to answer and share some other information with you, or share some things to the Taking Care of Us page. So I'll be sharing this over there shortly. And I look forward to seeing you next Tuesday at noon. Take care now.